Good morning, everyone. Thank you for joining us for this week's VFC webinar. This week's webinar is going to be centered around our Hawaii IQIP program. Our Hawaii IQIP program coordinator is January Miral, and she is going to be talking to us about it. Next slide, please. Just some housekeeping reminders for the QA team. Please monitor the chat for any questions you might be able to answer. For the attendees, today's session is going to be recorded, and you'll be able to find the slides and the webinar recording, as well as our past webinar recordings at the link listed there. Please ensure that you're muted throughout the presentation unless you are the one speaking. And if you're wanting to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov. In the subject line, please write email list so that we can catch it quickly. This is mainly for those who are not already on our list, but want to be kept in the loop about all VFC related updates. Next slide. If you have any questions during today's webinar, please use the chat to ask your questions so the Hawaii VFC program subject matter experts can respond directly to you. All other questions we'll be answering at the end of the presentation. Next slide. I'm going to go ahead and pass it over to our program coordinator, Danry, and she can go ahead and start. Danry.
Hello. So by the end of this presentation, our objectives are that providers will be able to understand what the Immunization Quality Improvement for Provider program is, the purpose of IQIP, the IQIP program timeline, and the benefits of IQIP to their practice. Next slide, please. So what is IQIP? Immunization Quality Program. IQIP serves to assist and support healthcare providers by identifying opportunities to improve vaccination service delivery strategies and incorporate changes into their current practices, supported in sustaining changes and improvement to their vaccination service delivery, aware of and knowledgeable about vaccination coverage and missed opportunities to vaccinate, and able to use available data from the HIR to improve services and coverage. Next slide. IQIP is a 12-month process during which public health representatives and VFC providers collaborate to implement provider-level QI strategies to increase vaccine uptake by improving and enhancing vaccination workflow. Next slide. As aforementioned, the IQIP program is a 12-month cycle. The initial visit consists of providers' vaccination workflow observation, and initial coverage is reviewed. QI strategies are then selected, technical assistance is provided by the IQIP consultant, and action items are chosen for strategy implementation plans. At the 2 and 6 month check-ins, we review progress towards strategy implementation, we provide any technical assistance that the provider will need, and we go ahead and review strategy implementation plan and update as needed. At the end of the cycle, we review the progress towards strategy implementation and update as needed, provide any technical assistance the provider may need, and go over year coverage to better understand where the providers are at the end of the cycle. Next slide. IQIP promotes and supports implementation of provider-level strategies designed to help increase on-time vaccination of children and adolescents. The IQIP strategies call for quality improvement activities that focus on improvements to the vaccination workflow. Next slide. There are 4 IQIP strategies plus 1 awardee developed strategy that Hawaii has yet to implement. The first is schedule the next visit. Second, leverage the HIR system. Third, give a strong vaccination recommendation. And lastly, strengthen vaccination communications. Next slide. During this segment, we will be going over benefits of the immunization QI programs. Next slide. Quality improvement programs such as IQIP analyze processes and use a systematic approach to improve performance. Like other QI programs, the IQIP program is based on these basic steps. State the problem and desired result, use data to understand the problem, identify strategies for improvement, implement strategies and refine as needed, evaluate outcome. Beyond simply increasing vaccination coverage rates, conducting immunization quality improvement can provide additional benefits. Next slide. The broader effects of QI programs are as follows: addressing the burden of vaccine preventable diseases, catching up on well child visits and recommended vaccines, reducing missed opportunities, increasing vaccine confidence, and using practice-based coverage assessments and performance improvement. Next slide. Thank you so much for attending this presentation. If you have any questions at all concerning the IQIP program, feel free to reach out to me. Thank you.
Thank you, January, and thank you for all who joined us today. We ask that you please complete the following BFC webinar satisfaction survey just so we can get a better idea of how you folks are enjoying this, or if there's anything we can do to improve it. We'll go ahead and drop the link for that survey in the chat. If you have any questions, you can go ahead and unmute, or you can ask your question in the chat and one of us can answer it. Otherwise, we'll be here till about 10 o'clock monitoring for any other questions you might have. This will conclude our webinar for today, so thank you.